Hi, I'm Dr. Travis Kendall. This is Dr. Tim Gangle here from Texas Sedation Dental and Implant Center. Wow, what a crazy time we're in right now. The government this last week, actually on Monday this week, shut us down until April 21st unless it's an emergency, and they're really wanting just life-threatening emergencies. What we've found is that there are people that have extreme pain that we're going to have to treat. If we can call in antibiotics, we're going to do that. But this is a crazy time. We cannot have our offices open during this time unless we're treating someone in pain. So we're coming out with this new option. It's called a virtual consultation. If you're an existing patient, you have our number. You can call us and we can talk over the phone and take care of possible emergencies that might happen. If you're not our patient, we're setting up this virtual consultation that will allow you to video conference with us one-on-one, meet with one of our doctors, and talk about whatever issue you're having so we can make a determination and make a connection so that if you do need antibiotics, if you do need anything, we'll have a connection where we can potentially get you through that pain. Or if you need to be seen because you do have a life-threatening, emergency dental infection or swelling, or anything where it's just so much pain you can't handle it, we want to keep you out of the emergency rooms so that we're not clogging up our emergency medical doctors on toothaches. We want to be here, figure out what your problem is, we had one lady that came in this morning, it's a chronic infection that's kind of flared up on her. Antibiotics are going to take care of that. If they're acute infections meaning that it's your nerve is dying in your tooth and it's flaring up. It didn't die a long time ago like the lady we saw earlier today. Antibiotics aren't necessarily going to take that pain away really fast. We've got to get the nerve out of the tooth. We've got to get that tooth out to really alleviate the pain in the short term. And so those are things that we could potentially determine over a phone consultation, a video conference to figure out what we need to do to get you out of pain. That'll help us be able to figure out how we can help you best. So Dr. Gangle or one of our other doctors will be available for those video consultations depending on when you schedule with us. We'll have different doctors on call at different times. Dr. Gangle is absolutely amazing at talking through, asking the right questions. Dr. Gangle, what do you have to say about virtual consultations and how you think that's going to help?
Like Dr. Kendall was saying, we'll hop on a video conference with you, ask you some questions, try and dial in what's going on. And antibiotics may be an option sometimes, but if antibiotics aren't working for you, we'll get you in. If you have any swelling or you're getting swelling in your face, that's considered a life-threatening emergency because that swelling can affect your airway, your eyes, all that kind of stuff. So it's our responsibility right now to keep you from going to the emergency room because they're in such high demand that we want to take some of the pressure off of them by getting dental emergencies in here and getting them taken care of, whether it's through antibiotics or taking a tooth out, doing a root canal, whatever we need to do to get rid of the infection and get you comfortable again is what we're going to do. And we'll make sure that we get you taken care of. We'll have someone answering phones and getting set up for those virtual consults online to where you can pick a date, you can pick a time, and it'll be one of the doctors from our practice. We have several that we work with. Get on there one-on-one and just see if we can't figure out what's going on and come up with a plan for you to get you comfortable again.
Awesome. Thank you. We look forward to hopefully not seeing you if you're in pain.